Welcome to Nurse Practitioners Changing Practice. I'm Carol.
Hi, I'm Nina.
Today, we are going to talk about an interesting subject. We are going to talk a little bit about the DNP, or the Doctorate of Nurse Practice, and the different tracks you can go on. What type of a degree should you get it? How will it help you? And those kind of things. So, Nina, tell us a little bit about the different tracks that they can go to be able to get a doctorate.
So a doctor of nursing practice is a practice doctorate. And depending on what accreditation organization your program is certified by, there's different concentrations for the doctor of nursing practice. So the ones that are common, that are more common than others, are the nurse practitioner tracks. So a doctor of nursing practice in family nurse practitioner, adult gero primary care, adult gero acute care, pediatrics, psych mental health, women's health, that sort of thing. There are also doctor of nursing practice programs in leadership and in education. And so depending on what certification body or accreditation you upheld to for that academic program is the types of programs that the different academic institutions offer, right?
Right. So like if you work for a college and they apply for accreditation, they might have multiple tracks for the DNP, or they might be more restricted to one or the other.
Right. Or you might, so there's certain accreditation bodies that support a doctor of nursing practice in leadership and in education, whereas there's other certifying bodies that uphold the philosophy that a doctor of nursing practice is only clinically based. So those are nurse practitioners or nurse practitioner degrees.
And so that I have my DNP in nurse practice. And when they first came out with this program, they really did not know how to structure the course. So it ended up looking more like a PhD program, that you kind of did the way you gathered your information and wrote your paper and did your research. And now I think it's transitioning more to what it's supposed to have been, because a doctor of nursing practice, like you said, is a clinical doctorate, meaning it's not making new science, it's bringing evidence-based practice into your practice and knowing how to set that up and structure it.
Right. And to improve ways to improve practice.
Right.
So it's all about a scholarly project of how you can improve NP practice, whether that be a quality improvement project or a practice guideline
or a policy
analysis. Right. So it's something to do with improving, assessing, analyzing, and improving practice, advanced practice.
Now I can see how it changed my thinking when I had my master's, and I mean, you hear this a lot. I'm a clinician. I don't understand what this is going to do for me. So what it did for me was really opened up the door to how to research, how to get that strong evidence-based policy or whatever I was going to do to implement, and how to build that program and analyze whether that program was working or not.
Right.
So, to me, the way I like to explain it is, as an associate degree nurse, you don't necessarily understand what the bachelor's degree is going to do for you until you go through the bachelor program. And then you see that it expanded your view and you were able to see things that maybe you didn't see. You're still an RN, and you still can function in the RN capacity as an associate or a bachelor degree nurse. But the bachelor degree nurse has a broader scope of view. And I think that the DNP does the same for the nurse practitioner after graduating from an MSN program. It just expands your knowledge base so you know how to go about bringing evidence-based research into practice, how to convince the higher ups why they should change something, give them the proof and the statistics, and measure those changes.
Right. and that doctorate gives you the tools to be able to do that and to look at your practice differently. And so that's the doctor of nursing practice. The PhD program is a doctorate of philosophy in something. So a PhD in nursing is the doctor of philosophy of nursing, and that is a research-based doctorate. So you actually do something to contribute something new to the science of nursing, right? So it's research based. It may or may, it may be something that would improve nursing practice, but not necessarily, could contribute to nursing education or healthcare in general of different populations, or developing a new tool to measure something. So it's contributing a new something new to the body of science, and in the case of nursing, it would be contributing something new to nursing science. So if you are wanting a doctorate that's research based, perhaps you want to go into academics where you want to be in a research institution. A PhD in nursing is something that would be worthwhile. DNP, the doctor of nursing practice, certainly are academics as well. It's just a different aspect of academics, clinically based, and DNPs do research. It's not that they don't, but their training of their doctorate is different.
And I can honestly say, working through a lot of the projects with the DNP students, they really do change practice.
They really do. They come up with amazing projects.
Just things that you don't even think about. And when I'm working with my DNP students, I'll tell them, look at your practice and find where the problem is. Like in my research, it was children who had really bad decay. I was out in rural America and I was seeing really, little babies 2 and 3 and 4 years old that were having surgery based on the decay in their mouth. And I was looking for what research says I can do to change my practice to help with that problem. And we really did change our practice.
Mm-hmm.
It really made a difference. I've seen other projects do, just amazing things. So it is a truly a changing practice type degree.
Yes. And it's an, most students that go through the program really enjoy it because they really learn so much about their practice or improving some type of advanced practice, some aspect of advanced practice. Makes you think differently. It makes you write differently. It makes you, I believe, I don't know what you think, Carol, but I think it makes you a better clinician because it really.
Well, I mean, like I said, it's the same as when you say, try to explain, well, how did the BSN help you from the associates?
Right.
It's really the same concept. It opens you to more ideas, more ways of measuring, how to write better, how to express yourself better, how to look for things better. And I think it does the same for the nurse practitioner. I think
Absolutely.
very worthwhile to do. And then of course there's other ways you can go into leadership. You can go into education. You were talking about those as DNPs, right?
That's right. So there are some programs out there that have a doctor of nursing practice in leadership. So if you are in nursing administration where you are and you want a practice doctorate, there are DNP programs in leadership. There are DNP programs in education, in nursing education.
And so there you would be doing projects that would change practice in leadership in some way.
Yes.
Implementing policy, things like that.
Policy, leadership, management, and
then we have the education piece. If you're an educator and you get a doctorate in DNP in education, that
nursing education. Yeah, a lot of people who get a DNP in nursing education or a nurse educator are clinical nurse educators in facilities, or they're educators in an academic institution, or they're an educator in some kind of, medical equipment company, pharmaceutical company, have their own business kind of thing. So there's such a variety of tracks that you can pick from with a doctor of nursing practice if you really want that, improving your actual clinical practice as an advanced practice nurse.
And
It
then
is, yeah.
Yeah, I mean, and then, I mean, I was thinking of, because I get the question of, well, what will it do for me? Will it change my pay? Well, as an
Mm.
associate's degree nurse to a bachelor degree nurse, it didn't boost your pay a whole lot either. You got a little
Right.
bit, but it changed how you were able to practice as a nurse.
Right.
This opens doors for you that you didn't have necessarily open.
Yeah.
And it helps you really understand your practice better and what you're doing with it better. So
Right.
you've gone, then you know that you've taken it to the ultimate level. It's a terminal degree,
It's the
right?
terminal practice degree. That's right. And there is some discussion in nursing organizations such as the Association of American Colleges of Nursing. There is a position statement to push for the entry level of a practicing nurse practitioner to be the doctor of nursing practice. Now, that hasn't come into effect yet. There was a position that was supposed to happen in 2015 and it didn't pass and it didn't happen. And now there's another position draft to have that start in 2025, but there still isn't a consensus on what will happen with that. My sense is that, it's a tough argument. One side of the argument is, as nurse practitioners, we work with other healthcare practitioners that have doctorates. Occupational health entry level is doctorate. Physical therapy now, DP, was it Doctor of Physical Therapy, DPT,
Pharmacy.
pharmacists. So there's so many other so many other healthcare providers or healthcare team members that are doctorally prepared at the entry level of practice, obviously medical doctors. So that's part of the argument. And part of the argument is just the importance of having that knowledge to be able to adequately assess and evaluate clinical practice in a very systematic way for improving, patient care, and for improving, advanced practice. So the jury's still out, the jury's still out. We know that there's a lot less just masters, MSNs in nurse practitioner programs. There's less programs, but they're still available. There's still postmasters programs, and there's NP to DNP programs or baccalaureate to DNP. So there's so many choices out there for DNP. And so, this discussion is about just really considering that to be your terminal degree. If you're thinking about becoming an NP, really consider doing the doctorate. Or if you're already a nurse practitioner and you want to have other avenues and other aspects and thinking and evaluating your practice differently, consider a doctor of nursing practice.
And like I say, it really does. It opens doors for you. You can teach in academia and still practice. You can.
That's right.
That's something that it opens that you can teach at the doctoral level.
Yep.
It opens that door for you. You can speak, be a speaker about certain subjects, get published. There's a lot of things that it does open the door for you. And I just think it gives you more reflection on your practice.
It does. It's more reflective practice. And again, more knowledge about how to assess practice, how to improve practice, how to measure outcomes of your practice and improve patient care.
I mean, and
right?
looking at some of the projects, I mean, I had one student who did doll therapy as
Wow.
a way to reduce anxiety, and
Yes.
studied that and made
Yes.
a complete change in their entire unit. I had another student who her project was so good. She worked in that small OBGYN rural hospital that have done things the same way forever and ever and ever. And never change, right? And she came from an institute where it was research based. And so she, was looking at some of their practices and going, oh my gosh, they're really behind the times. And we got to talking, how do you change that culture?
Yes.
And she was able to, one provider at a time, convince
Wow.
by showing them the evidence to try these new methods. And then as they saw results,
Mhm.
she was literally able to reduce an induction in labor when you're induced, like by an hour of time.
Wow.
And as a laboring woman, an hour is a long
That
time.
is a long time.
So she really improved practice in that town, and she showed those people what a doctor of nurse practice can bring to the table.
Yeah. And we are not saying that nurse practitioners who have master's degrees are any less than someone who has a doctor of nursing practice. That is not what we're saying. We're saying that to expand your knowledge and your experience, considering a doctor of nursing practice is a wonderful thing to obtain if you are so inclined to, or you're interested in it, or if you're listening and you're considering going to NP school, consider going for a DNP, getting your NP degree and your DNP at the same time. It's something to consider to really again support improving clinical practice and really supporting care of our patients, right?
Absolutely.
So it's just, I think, interesting to talk about, and it's interesting for our listeners to consider, and just to know out there's discussion of whether or not in the future, that will be entry level at the doctorate level.
Yeah, and I'm sure anybody who is practicing now has at a master's level will be grandfathered in if they ever
Oh,
did.
I think so
That's
too.
just
And
absolutely.
yeah, and we just need providers. So, the
Yeah.
other side of this that I'm sure our listeners are thinking of, yeah, that sounds great, but we need more nurse
We need more
practitioners because we
providers.
need more providers, right? So that's the other aspect of, academic programs really saying, hey, we still need providers, and and some students just want to do their masters and become nurse practitioners and stop at that level, and that they should have that choice. So
Yeah, and they are good providers. They're
excellent. Yeah, absolutely excellent providers. Absolutely excellent. Years ago, when the nurse practitioner position was created, nurse practitioners weren't even at the master's level. So now we're
it was
master's prepared, and maybe in the future that's where they're looking to be entry level at a doctorate level. The jury's still out, but I can see the argument at both sides. I really do, because I think, if you want to become a nurse practitioner and you're not ready, or, pursuing a doctorate would be too, longer, more costly, something that you're not interested in. I still think that the choice, I would like to have students have the choice to do that. But time will tell, and what the organizations, the certifying organizations and the National Organization of Nurse Practitioner Faculties, it'll be very interesting to see what all those organizations come to a consensus on. And I know that the National Organization of Nurse Practitioner Faculties organization is collecting and analyzing and presenting data to support the argument of entry level of practice at a doctorate, at a DNP level. So we'll keep reading and keep listening.
It come down that it does become where that is the only option if you want to go back to school. But again, it's in the future. So just something for you to think about. What I would like to challenge our listeners to do is to write comments
Yes.
about why you became a DNP, or what your project looked like, and what you decided to do, how you changed practice,
Right. And what do you think about this topic?
Yeah.
Do you think the DNP should be at the entry level for NPs in the future, or what is your opinion about it? We want to know what you think.
Yep. So please subscribe to our channel so you can have more episodes and listening more. We try to bring new topics all the time, and new cases to solve. So
That's right.
thank you again for listening, and we will see you again next week.
Bye-bye.